All right, good morning. This is Sarah Willey from Miller Johnson, and we are here for Miller Johnson's webinar on the new EEOC guidance regarding COVID-19 vaccination. So thank you for joining us. Happy Friday. I hope everyone has one thing at least planned for the weekend that is fun, maybe connecting with friends or family in some safe way or celebrating the holidays. For those of you who did not join our webinars 2 weeks ago regarding the vaccine, I just want everybody on the call to know that on our COVID-19 website, we do have recordings from a two-part series regarding the COVID-19 vaccine from 2 weeks ago as well. Okay, so you might want to take a listen to those. I wanted to rejoin you all regarding the vaccine because a few days ago, the EEOC issued some guidance regarding the vaccines that is certainly worth talking about. Okay, so that's what we're going to do today. Just a couple of very broad messages. First, number one, the EEOC gave the green light to both employers administering the COVID-19 vaccines and also mandating the vaccines, although that second part, not surprisingly, much as we expected, comes with some exceptions, okay? Comes with lots of buts, and we're going to talk about those. What this means to me, and I'm sure for all of you, is, man, I just have this feeling that we're coming out of that dark, dark tunnel, and we are seeing the light, right? I know it's going to be yet some time before people are widely vaccinated, and it's going to be several months before the vaccine is widely available to healthy individuals under the age of 65. But yet, I feel like we can see where that end is, and I hope you guys all have that sense of relief that I also have. Okay, so what am I going to specifically talk about today? Number one, I want you all to know what is critical if you plan on requiring employees to receive the vaccine. And then secondarily, I want you to know what's important if you don't plan to require it. The reason I framed our talk today with these two questions is that one thing is apparent to me, and that's the first thing that employers across the board seem to be thinking about in deciding is whether or not we're going to mandate the vaccine. So I think it's helpful for you all to understand what both of those options look like. What are my obligations if I mandate it? And then secondarily, what are the important legal considerations I need to be thinking about if I don't mandate the vaccine? Okay, so that's what we're going to cover. All right, so unfortunately, I've got it, but before I dive into those questions, I do want to give some information and a bit of an update on the Pfizer vaccine, and remind you we've got more vaccines coming too. And the reason I need to give you more information about that vaccine is you'll see as we talk through the EEOC guidance, some of this becomes very important and relevant, okay? So on December 11th, last Friday, the Pfizer vaccine received what's called emergency use authorization from the FDA, okay? Its authorized use is for the prevention of COVID-19 for individuals 16 years old, or 16 years and older, okay? Important to understand that. I'm getting lots of questions about whether schools can mandate kids get the vaccine. The answer to that question is real easy right now, and that is, well, no, because we don't currently have a vaccine for kids unless they're at least 16 years or older. I think that'll change over time because they are beginning to study kids under the age of 16 as well. Okay, second, the vaccine has certain contraindications. Now, what that means to a medical provider is this vaccine should not be given to certain individuals, okay? The only contraindication that the Pfizer vaccine has right now is for those with a known history of severe allergic reactions to any component of the vaccine. Now, contraindications are different than warnings, and we're going to talk about those in just a second, okay? But anyone who has a known history of severe allergic reaction to any component of the vaccine absolutely shouldn't get the vaccine. Possible side effects as of now of the vaccine are listed on this slide, and basically they're what you would expect. They're the same as, quite frankly, as the flu vaccine. And as it's been explained to me as a non-scientist, those side effects are the result of someone's body thinking that it has COVID, even though it doesn't, and starting an immune response to fight against it, and then realizing that it doesn't really have to fight against anything because that person doesn't actually have COVID. So we see these side effects for a short period of time, generally less than 24 hours. The Pfizer vaccine does not actually have any elements of the COVID virus in the vaccine. It simply triggers an immune response. So those side effects don't mean that anybody has COVID or could spread COVID. That's not the case. Okay. All right. There are two fact sheets that the FDA publishes for vaccines that are given emergency use authorization. And these can be found on the FDA website, okay? There's one for providers administering the vaccine, and there's one for recipients and caregivers. As we think about employers' role in the vaccine, I think it's quite important for you to take a look at the fact sheet for recipients and caregivers. That fact sheet will almost certainly be given to your employees when they receive the vaccine, whether it's in your workplace, whether it's because you mandate it, whether it's because it's voluntary and it's at a clinic or a doctor's office. They almost certainly are going to be given this fact sheet. So I think it's helpful for you to know what it says. So if you look at the bottom of slide 8, that is a link to where you can find that fact sheet yourself. And I've had some employers say, oh, this is fantastic. I have employees with lots of questions. I'm just going to give them a copy of this fact sheet. That's fine, okay? That fact sheet, right, now again, this is something that's going to be given to people when they receive the vaccine, instructs that individual receiving the vaccine to tell the person who's administering the vaccine if that individual has any of the following conditions. Okay, and they're listed here on slide 8: allergies, fever, bleeding disorders, if you're immunocompromised, if you're pregnant or become pregnant or plan to become pregnant, if you're breastfeeding, or if you've received another COVID-19 vaccines. There's a reason I'm reading these to you guys now, because we're going to be talking about this list in a minute when we think about the EEOC guidance. Because notice what this fact sheet is doing is telling the person who gets the vaccine to disclose if they have health conditions, many of which are disabilities, okay? And the reason they're supposed to disclose those is because currently we're not really sure what impact the vaccine might have on several of these conditions, okay, because they weren't thoroughly studied as part of the initial clinical trials, okay? So the person getting the vaccine is supposed to disclose whether they have any of these conditions, and then they're supposed to have a conversation with that provider administering the vaccine as to whether or not it's a good idea to get it or not, okay? Now you'll notice pregnancy and breastfeeding are on that list. Those generally are not disabilities. The reason they're on the list is because, again, the clinical trials didn't study the vaccine's effect on people who are pregnant or breastfeeding. Okay, so don't assume the vaccine is necessarily going to have adverse effects. It's just that we don't know yet. It's my understanding that they are beginning to study that more. All right, and what else does the fact sheet say that I want to highlight to all of you? Well, there's 3 more places on the fact sheet that I think you all need to be aware of as employers as you think through how you're going to frame your employees receiving this vaccine and whether you're going to mandate it. Number 1, there's a section that asks the question, right? It's sort of in a Q&A setup. What if I decide not to get the Pfizer vaccine? And the answer that is provided on the fact sheet is, it is your choice to receive or not receive the Pfizer vaccine. Should you decide not to receive it, it will not change your standard medical care, okay? Why is that question on there? It's on there because the FDA emergency use authorization regulations require it to be on there. Because this vaccine has received emergency use authorization, the FDA says from a healthcare standpoint, healthcare providers can't make decisions about your standard medical care based on whether you get it or not, okay? Now, that's not the same thing as whether an employer can mandate the vaccine as part of employment, okay? That's a different analysis. Just because that statement is on the fact sheet doesn't necessarily mean that employers can't mandate the vaccine. But I think you all need to understand that it says this, because you might, if you are an employer that is going to mandate the vaccine, you're probably going to have to explain that. You probably are going to have employees coming back to you with this fact sheet and asking why you're requiring it if it says on the fact sheet that it's their choice whether to receive it or not, okay? What else? The fact sheet does talk about pregnancy and breastfeeding, and it asks the question, what if I'm pregnant or breastfeeding? And the answer is, if you're pregnant or breastfeeding, discuss your options with your healthcare provider, just like I mentioned, okay? And the third thing I want to point out on the fact sheet is that it talks about a vaccination card, okay? So everyone who receives the COVID vaccine is going to get a vaccination card. And I can't remember if it's the CDC or the FDA that's publishing that, but in any case, it's going to be the same standard card across the board. And it is going to have dates as to when everyone gets their first dose, and then again when they get their second dose. I point this out to all of you because I'm getting a lot of questions about how an employer might confirm whether or not an employee has received the vaccine. Okay, now, don't forget, right, that's a lot of information. All of that information is just about the Pfizer vaccine, okay? We know we are going to have more, and each one of those may have slightly different information, might have different counterindications, and might have a different fact sheet, okay? In fact, today, there's a Moderna vaccine that's expected to receive emergency use authorization. That vaccine is also going to have its own fact sheet, so keep an eye out for that. I don't think it's going to be substantially different. I just don't want you guys all to lose sight of the fact that now that we know a lot and have learned a lot about the Pfizer vaccine, all of that information may be a bit different when we start also using other vaccines. Okay, so we should be, individuals in the US will almost certainly be receiving also the Moderna vaccine by the end of the year. They're talking about that happening as soon as next week. And there's 3 other vaccines that could also receive FDA approval for use in the United States. AstraZeneca, Johnson & Johnson, and Novavax all have vaccines that are in phase 3 of clinical trials and are sort of lined up for the potential to be approved by the FDA. So we'll be keeping an eye on that. Okay, so I'm going to take a deep breath there, and I'm going to look at what questions I've received and see if I can answer any of those. Yeah, so the questions, I've gotten a couple of questions, and they're in line with some questions I got when people signed up too, and they are along. One question is, look, we're being really generous right now with regard to providing employees with paid time off when they need to be gone for COVID-related reasons, whether it's because they have to isolate, because they have symptoms, or because they have to quarantine, because they had close contact, right? What does that look like if the vaccine is available to our workforce? Can I stop doing that, okay? And I am going to talk a little bit about that later on, but the answer is yes, certainly, and I would expect many employers to start transitioning away from providing generous paid time benefits to employees who are missing work, and instead strongly encouraging a vaccine, if not mandating a vaccine. Now, of course, right, we need to check off any other boxes, legal boxes, that could require us to provide those paid time benefits. We all know about the FFCRA, and in particular, emergency paid sick leave, that is set to expire at the end of this calendar year. As of now, it does not look like there is a plan to extend that in Congress. That is not part of Congress's relief bill that looks like it could pass today. But there are some state requirements too that could apply. Okay, question, do we know when more vaccines become available, which vaccine we are getting? No. This information about the availability of vaccines is coming from 3 different places. It's coming from the federal government. It's coming from our state Department of Health. So the Michigan Department of Health has a state plan and a state allocation plan on its website. So if you go on the Michigan Department of Health website, you can click on a tab that talks about the vaccine and find that plan, and information from our local health department. So it's sort of filtering down from the feds to the state to each of our local health departments. But there is no detailed information about which groups of people would get which vaccines, okay? Let's take the first one. So let's take the first question. What do you need to know if you plan on, or let's say even you're thinking about mandating that employees receive the vaccine, okay? Number one, the EEOC guidance very clearly says the COVID vaccine is not a medical exam. So the vaccine by itself is not a medical exam. That means that employers can decide to mandate that employees receive it, right? They don't have to demonstrate that it's job-related and consistent with business necessity. Take a deep breath, though, because there's a lot of buts to that statement, okay? The first one is those screening questions, okay? Remember how I said that the individual administering the exam is almost certainly going to have a conversation with that person receiving it about whether they have any of those health conditions on that list. And if they do, have a more detailed conversation with that person with regard to the condition and whether they can receive the vaccine. That is a medical exam. Okay, so asking those screening questions is a medical exam. That only matters, though, if the employer is the group that is administering the exam. Okay, so let me play this out for you. If an organization is mandating the exam and also mandating the vaccine and is also administering the vaccine themselves, which, by the way, is happening right now because the first round of vaccines went directly to hospitals and hospital systems to give to their own employees. Okay, so if those employers are mandating it and they are giving the vaccine themselves, they're administering it themselves, engaging in those screening questions, the EEOC says is a medical exam, and that's a problem, okay? That means then all of a sudden, the vaccine has become a medical exam, and if that employer wants to mandate it, they have to demonstrate that it's job-related and consistent with business necessity. Now, I was really hoping the EEOC would have a clear position on whether the COVID vaccine is or is not, frankly, just across the board, job-related and consistent with business necessity. And I was hoping they'd do that because we're living in a global pandemic. And quite frankly, I was hoping they would just say that it is. Unfortunately, they were unwilling to do that. Instead, they said, employers, we're not going to say that it's automatically necessary for you to mandate this vaccine for your employees. You have to take that on an individual basis, and you would have to demonstrate that it would be a direct threat to the employees or others if the employee does not receive the vaccine. Okay, now for some positions, think of employees who are providing direct care on COVID units. I think that's easy. But as we get farther away from that, that will be more difficult. Okay. Now I'm going to say it again because I just want to make sure that I'm being clear on this. This is a concern for an employer that is both mandating the exam and is administering the exam itself. If we take away either of those factors, so by making it a voluntary decision by the employee or using an independent third party to administer it, we don't have this problem. Second, with regard to mandating the vaccine, the EEOC confirms that if you require it, you can request proof of the vaccine, but reminds us that we would have to keep that in the employee's confidential health file, right? I'm sure we all realize that. And as I mentioned, we can just request a copy of that vaccine card that the employee is going to get. Okay, finally, and most significantly for employers who mandate the vaccine the EEOC confirms, this is no surprise, we've been warning folks about this from the beginning, that even if you mandate it, employers are going to have to consider accommodations under both the ADA and religious accommodations under Title VII. Okay, so if an employee has a health concern and cannot receive the vaccine, remember the counterindications, the allergies, and also the list of other things that are yet to be studied, okay? If employees have those things and request to be excused from the mandation because of that health issue, then we need to have an accommodation process in place to address that. And then also, if an employee has a religious objection to taking the vaccine, then we need to have an accommodation process in place to address that. I talked much more in depth about the legal analysis of those accommodation obligations in the webinar 2 weeks ago. So for those of you who didn't listen to that and have questions about that, I encourage you to go back and take a look at that presentation. So for employers that want to mandate it, if you are an employer with employees that don't yet have access to the vaccine and you're wondering what you can do now to start preparing, start getting your accommodation process ready. You're going to want to have request forms for people to use. If it's because of a disability, you're going to want to have a medical verification form for the employee's healthcare provider to complete, et cetera, okay? And I should say as well, for those who subscribe to our COVID-19 Resource Center, we are building a new tab with lots of information specific to vaccines, and that's going to be up next week. That will have policies, COVID vaccine policies, that's going to have that accommodation process in there as well, okay? All right, also with regard to accommodations, pregnant and breastfeeding employees, it's my opinion, should not currently be mandated to take the COVID-19 vaccine. Even though pregnancy and breastfeeding usually is not a disability that falls under the ADA, don't forget Title VII has a component called the Pregnancy Discrimination Act and says we can't treat pregnant employees less favorably than others, okay? And because pregnancy is also a medical reason that's on the list of things to be considered when employees are taking the vaccine, if we are accommodating disabilities, I would advise employers to also include pregnancy and breastfeeding into that list as well. There's also obviously a component of discomfort in the idea of requiring a pregnant employee to take the vaccine if it's against their advice, against the advice of a healthcare provider, and if the vaccine hasn't been studied for pregnant employees as well. As part of that accommodation process, right, employers mandating the exam will essentially have to provide accommodations to individuals with disability unless they can show that the unvaccinated employees would pose a direct threat, okay? So again, that's that significant risk of substantial harm to the health or safety of that person or others that can't be reduced by a reasonable accommodation. And as I mentioned before, that the EEOC says, look, employer, you've got to take that on a case-by-case basis. We are not going to say across the board that we think any employee who doesn't get the vaccine poses an undue risk. You've got to look at the nature of the risk, the severity of the harm, the likelihood of the harm, et cetera. And that is going to matter Factors that are going to play into that, quite frankly, are what is this person's job? What's the likelihood they could be exposed to vaccine? Do they work in close proximity with others, et cetera, okay? I wish I could tell you that we know for sure that employees who refuse to take the vaccine pose a direct threat, but the EEOC would not go there, okay? Just a reminder, if an employer mandates the vaccine and an employee refuses to get it due to a disability or religious belief, that does not automatically mean we get to exclude them from the workplace. Instead, we need to look at alternative accommodations that would allow them to stay in the workplace, okay? Now, this is where we come to a real odd crossroads. When we generally reach this place with other vaccines, the biggest example being the flu vaccine, right? So healthcare employers have been mandating the flu vaccine for a long time. And so they're accustomed to engaging in this reasonable accommodation process. And oftentimes the solution for an employee who refuses to get the vaccine is to allow them to stay in the workplace, but guess what? Wear a mask, engage in social distancing, et cetera, okay? Now, the reason I say we come to a weird crossroads is we're already doing those things. So it's not yet real clear what that all means, okay? If somebody refuses to get the COVID vaccine, then would the EEOC say, we just have to let them stay in the workplace and continue taking all the proactive measures, which, by the way, we've been telling our employees all along we're taking to keep them safe at work? Or can we exclude them from the workplace? My read from the guidance is the EEOC thinks we have to let them stay in the workplace and just keep doing the things that we're doing anyway, which is a very, in my mind, that's a very odd result and may weigh against a decision to mandate, right? So that means if we mandate, then people can request these accommodations, and if they request them, we probably have to provide them and allow them just to keep working and wear masks and distance and do the things that they were supposed to do anyway. There's a few exceptions to that. I mean, if we've got healthcare providers that are giving direct care to individuals with COVID, and those folks decline to take the vaccine, I think we could reassign them to different roles, for example, or take them out of the workplace. Otherwise, that really is going to be on a case-by-case basis, and I think a lot of times the employee gets to just keep working, wearing a mask, et cetera. We may come to a time in the spring when those who have been vaccinated don't have to wear masks at work anymore. Well, isn't that a wonderful, wonderful thought? And maybe spring is too aggressive, maybe it's summer. But those who have declined the vaccine do. Okay, so we may come to a place where those paths sort of split. Right now, that does not look to be the case. Okay, let's take the second question, which is a really easy one, and then I'm going to go through some of the questions that were provided ahead of time and also some that have come up during this presentation. So if you're an employer that already knows we don't think we're going to mandate the vaccine, at least not out of the box, so what do I need to know then about this EEOC guidance? And the good news for you is not a whole lot. I think you need to understand those screening questions exist. And so if you are an employer who is making the vaccine voluntary but providing it, and that is happening right now, as I said. I mean, we have our hospitals and hospital systems many of them, if not most of them, are providing the vaccine themselves, but they're not mandating it, okay? Understand that those screening questions do engage with the employee with regard to their underlying health issues. The EEOC says it's fine to have that conversation with the employee so long as it is completely voluntary. It's voluntary for the employee to get the vaccine, and if they decide, I don't want to talk about whether I'm pregnant or breastfeeding or have allergies, then that's okay too. They don't have to. And then obviously the employer can decline to administer the vaccine if the employee says, I don't want to tell you whether I'm pregnant or not. That's fine, that's the employee's choice, but then they don't get the vaccine. And if there's any paperwork or other information that comes out of those conversations, don't forget that's strictly confidential. And I suppose we should also think about how we're administering the vaccine and who else is present if we are asking those questions. We wouldn't want to be asking those questions, for example, in front of coworkers if this is being done in a room and there's a lineup. Okay, now the good news is it's COVID time, so that's unlikely to be the case. People are probably coming in one at a time and separately. The second thing that employers who are not mandating the vaccine need to remember is confidentiality of medical information. So I think even employers who are making the vaccine voluntary, most if not all of them are going to still, they'd like to know who's received it and who's not, if for no other reason than for the purposes of contact tracing, right, in our workplace. So many of you probably have lived through an employee who is positive for COVID and has had to try to figure out who's had close contact with that person. Well, as part of that process, you're going to want to know who's been vaccinated for COVID or not, okay? We can, even if we make the vaccine voluntary, we can ask our employees to give us, to tell us if they have been and give us a copy of that vaccine card. Okay, so don't forget though, again, there's confidentiality considerations. We got to keep that in their file. If I see most employers as of now, as of today, are generally not mandating the vaccine. There's just not, the general approach seems to be, number one, we don't have access to enough vaccine to mandate it right now, even if we wanted. So we're comfortable starting with a voluntary approach, and we're hopeful that things will go really well and lots of people will raise their hand so that we can get close to that 70% of our workforce being vaccinated that we want. And if things go really, really well, we might consider mandating it in the future, okay? And so for those who are following that approach, I think you need to be thinking about, number one, an employee communication campaign. Educate your employees about the vaccine. We see lots of leaders getting the vaccine on camera or on film, right? And I see employers following that lead, right? Here's our CEO getting the vaccine. Here's our VP of HR getting the vaccine. Of course, that's only for businesses that have access to it, which is basically hospitals right now. But think about putting together FAQs and other information about it. Remember, though, the information we have right now is about the Pfizer vaccine, and so you may need to tweak it if it turns out your employees are going to have access to a different one. I do want to point out a really great website that is vaccinatewestmi.com. It's on slide 21. This is a website that's been developed by a coalition of a group of local healthcare departments, medical providers, and colleges and universities in West Michigan. And they've got some FAQs on there, and they also have a flyer that I think is quite good. In addition, if you are an employer in West Michigan, that coalition is going to keep updating that website to give you information about access and availability of vaccine, particularly by industry and sort of where we are in the different phases of rolling out the vaccine. So keep an eye on that. I think that's a really fantastic resource. The other thing that employers who are not mandating the vaccine are thinking about are, what's our legal option for incentivizing people to get it? If we don't want to mandate it, if we want to strongly encourage it instead, okay? Well, the first thing I'll say is be careful not to cloak a mandate as an incentive, right? And so we don't want to say, well, it's your choice whether to get it. We're strongly encouraging you to get it, but you're going to receive attendance points, right, if you miss work if you don't get it or something like that. Be careful about that. But assuming it's truly voluntary, the things that people are considering doing are giving PTO, paid time off, for employees who have to miss work in order to get the vaccine, right? So take away the hurdles that might be in their way to get it. And then what I mentioned before, starting to roll back those generous paid time off benefits for employees who are missing work for COVID-19 reasons, okay? Now, we're not doing that in a way that directly discriminates against folks who don't get the vaccine, right? Such that we're really mandating it. What we're saying is, if you need to miss work in order to quarantine because you've been exposed or because you get COVID-19, we might continue to protect those absences. By the way, we have to in Michigan under Public Act 238 anyway, but we're not going to pay you for those anymore, or the amount we pay isn't going to be unlimited, okay? I'm sure all of you have more ideas about incentivizing it. Okay, so I've done a lot of talking. I'm going to take a deep breath and talk through some of the questions I've gotten. Very common question, should I have a policy, right? I'm not somebody that loves to over policy things, but I think here the answer is yes. And I think you want to have a policy if you mandate it or not. The reason I say that is employees are just starving for information in this area. And I think if you write a policy, it might be a policy they actually read and find valuable. And I think they would appreciate the information you give to them. Number two, cost. Must insurance cover it? Yes. And if an employee doesn't have insurance or for some reason it's not covered, it's free anyway. The federal government is providing the vaccine free of charge to everyone. Do employees still have to follow our workplace requirements, right? The CDC, the Michigan Department of Health, our MIOSHA emergency rules after they get it? Yes. The answer to that is yes. Not forever, but I don't know when that will end right now, okay? So when your employees ask that question, the answer to that is yes, you do. As of now, the CDC says after you get the vaccine, you still should be wearing a mask, social distancing. We're still going to keep doing all of those things. The MIOSHA emergency rules are still in place for at least 4 more months, guys. Okay, so we're still going to be doing all of those things. Will schools require it for students? Well, as I mentioned, okay, as of now, the Pfizer vaccine is only for individuals 16 years or older, and Moderna is actually going to be 18 years or older. So the short-term answer to that question, in my mind, quite frankly, is easy, and the answer is no, they're not going to require it because we don't have a vaccine for kids under the age of 16. The more complicated response is that that is entirely up to, at least for public schools, up to the Michigan Department of Health. They're the ones who decide every year what vaccines students are going to be required to get. I can't imagine that in the 2021 school year that is going to be something that public schools require. Perhaps next fall, students might be required to have been vaccinated for COVID before they return. But I think some of that is just going to depend on where we are with COVID and where we are with vaccines getting authorization for kids under the age of 16. What about if you have employees working remotely due to ADA accommodations, can you only require those employees to get the vaccine and not require everyone? I would be very careful with that because you are treating employees differently based on whether they have a disability and have requested an accommodation. I think there's a way to frame that appropriately, but I would not frame that as we are going to only require it for our employees who have requested accommodations under the ADA. The way and I think you should probably talk to legal counsel more specifically, but the way I would approach that is viewing the vaccine as an alternative to the accommodation that you're already providing them, and offering that as an option. I wouldn't call it a mandation, though. This is a good question. So what if the employee, what if I have an employer now who's not mandating it, right? But is administering it. And so they're engaging in that screening conversation, which is okay. We talked about that, right? Because they're not mandating it. What if later they do mandate it? Is that a problem? The answer is no, it's not a problem. The analysis is it required at the time you have that screening conversation? Okay, so if when you talked to the employee and asked those screening questions, the vaccine was voluntary, then it's going to be fine. It doesn't matter if later for other employees you make it mandatory, although it doesn't matter for the employee that received it earlier, okay, that when it was voluntary, that doesn't impact the voluntary nature of the screening questions for them. Of course, if it's later mandated and the employer is still administering it, then that does impact the analysis for those later employees that are being required to take it if the employer is also administering the vaccine. Okay, so this is a good question because I think it's got a little bit of misinformation that I want to correct. So the question is, because those being vaccinated will be shedding the virus as their body fights it, are they to stay away from the workplace for a specific period of time? The people who receive the Pfizer and Moderna vaccines are not shedding the virus. There is absolutely no virus in either one of those vaccines, okay? So the answer to the question is no, they don't have to stay outside of the workplace. But I want to be very clear, because I don't want there to be a misunderstanding. Neither of those vaccines they have no virus in them. They only trigger an immune response, okay? So nobody has to stay outside of the workplace. When I say the employer is administering the exam, I mean the employer, for example, is a hospital and their own employees, right, are the ones giving the vaccine to other employees. If that employer is using a third party to do it, the employer is not administering the vaccine, even if it's on site. Okay, so if you use a third party to administer it, then you do not have to worry about the concerns with regard to those screening questions. I think that covers one question. If the employee receives the vaccine and then a few weeks later either gets exposed or has symptoms, do we still need to follow Public Act 2 238. I love that question because I also have been thinking a lot about that, and I love that the person who asked the question has as well. As Public Act 238 is currently written, the answer is yes, but there are lobbyists now trying to get our Michigan legislature to make changes to it to address that problem. Okay, and I'll leave it at that with regard to Public Act 238, except to say I think we're going to see some changes to that law. I'm almost certain we are in the next week or two. So be watching for a webinar on that, and we can talk more about it. Okay. One last question. Can we mandate it for some employees, but not others, depending on their position? And I think the answer to that is sure, so long as you can articulate reasons, business reasons for doing that aren't tied to any protected class, right? In other words, we are going to mandate it for our employees that work on production lines for which we can't maintain a 6-foot distance, or we're going to mandate it for our employees who are directly caring for COVID patients. I think that is certainly a viable option. Okay, so I'm going to end there, and I thank you all for joining us. I am sure we're going to be talking more about the vaccine, and I hope you have a wonderful weekend and also enjoy the holidays. Thank you.